Namaskar and very pleasant good evening to all the listeners of EBC Radio. As we all know that we bring in a special presentation on the airwaves of EBC Radio 1170 AM and brought to you with the kind compliments of Robert Wood Johnson University Hospital. Robert Wood Johnson University Hospital, as you know, is a sponsor of this program, and today we'll be talking about diabetes wellness and prevention program for South Asian community. I think it's a very, very important issue. And joining me today, our guest is Mariam, and she is MA Director, Community Health Promotions, Robert Wood Johnson University Hospital. And of course, we'll be also joined from Mr. Vipul Amin from Param Care Foundation. So I think it's going to be a great show. And I think the information is very valuable for our community because this could help you a lot. So let's welcome Mariam on EBC. How are you?
For the invitation. It's a pleasure for me.
The pleasure is all ours, and I think EBC Radio is very fortunate and very blessed to have this kind of informative program from Robert Wood Johnson University Hospital, because this will help the community a lot. And let's start. I have a few questions for you. Mariam, are you ready for me?
Yes, I am.
So, Mariam, could you please tell our listeners, Robert Wood Johnson University Hospital has partnered with Param Care to address diabetes in the Southeast Asian Indian community. Can you tell us a little bit about what you plan to do?
So let me give you a little bit of background. We partnered with Param Care a year and a half ago to do a community health needs assessment, and Param Care was instrumental in getting people around the table to do focus group to tell them what their impression of the healthcare system is and the health needs in the community. And as a good healthcare organization, we went back to Param Care, to the community, to let them know what the results of the survey was and the focus group, and also to plan for programs and events related to those health issues. So diabetes was one of the top issues. Also, the community health needs assessment talked about how diverse our area is in Middlesex County and how the hospital needs to look at all the other diverse communities around Middlesex County and address their cultural differences and also their language issues. And we decided to put a pilot project together with Param Care that is going to start now in the month of April to do diabetes education management for people that have diabetes. We are going to be doing this in our Old Bridge Fitness Center. It's free of cost. People can call Param Care to register and speak there to Nina. The phone number there is 732-404-0411. And they're going to be talking about diet, exercise, medication. We're going to be doing yoga, cooking demonstration based on the particular diet of the South Asians. How can it be healthier? We are going to be partnering with Param Care to send nutritionists, also interpreters. So it's going to be a program that's really going to adapt to the needs of the particular community that we're talking to.
I think, Mariam, I'm going to be your first candidate to come and join your this great initiative. This is amazing. My next question to you is, when and where will the program be offered?
So the program will be offered at the Robert Wood Johnson Fitness and Wellness Center in Parkland, New Jersey. It's 1044 U.S. Highway 9. As people register in the phone number that I gave, they will be given directions. We also have limited transportation for those community residents that cannot get there. We will also be providing transportation.
Why did you decide to focus on diabetes with this community, ma'am?
So when we did the focus group and we looked at the data that we had available, and we also talked to community residents, we saw that a lot of the topics were related to diabetes, people having people at home, and they knew that they had diabetes. So also statistics show that a lot of the ethnic minority communities around here have a high incidence of diabetes. We see that in our local health centers, and it's something that we need to address. When we come here from other countries, we need to adapt to a new Western diet. We might not have more opportunities to exercise. We come from more rural areas. Now we live in cities, and places are far, so we depend more on cars, so we don't do that much exercise. So these are changes that we need to address when we come here and we have a chronic disease like diabetes, to make sure that we know how to control our diabetes, where to go, how to monitor. If we don't have a physician, that we can identify a physician. What's the diet that we need to follow when you have diabetes, and how you take your medications. Diabetes, medication, and food are very related when you have diabetes. So all of those things are going to be addressed during the sessions that we're going to be doing in a manner that is not intimidated to the community, that they can share their experience, that we can give them support, that we can give them resources when we do the courses.
Ma'am, my other question to you is, what other factors affect South Asians' health and accessing quality health care?
I think that, one of the biggest issues that we see is lack of health insurance, lack of knowing where the resources are available. I think that providers need to understand what is the particular diet that they're following in order for them to better understand how to treat them.
And, folks, if you just joined us, we are right now joined with Mariam, and she is MA Director, Community Health Promotions, Robert Wood Johnson University Hospital, and this special program is sponsored and brought to you with the kind compliments of Robert Wood Johnson University Hospital. And I would like to invite my other guest at this time, and he is very well known individual, very well known in the community. Vipul Amin is from Parma Care, and Vipul ji, welcome to EBC Radio. You're joining us right now with Mariam is Vipul ji. Vipul ji, welcome.
Thank you very much, Kulraji. It's so pleasure and so talking to EBC Radio, such a popular radio for our community, and we love you guys.
We love you too. I think you guys are doing an amazing work, and if you could just be kind, let our listeners know about little bit about Parma Care.
Yeah, that is Kulraj. Param Care is a non-profit organization that we established almost 3 years back, and the main goal of Param Care is to support our community health in totality. If you see the South Asian community, we have like a lot of chronic disease issues, like as Mariam ji mentioned, that diabetes is the one area we really need the focus. On top of that, there are like a lot of problems that we notice in cancer-related issues. Like breast cancer is one of the topic where our Asian community need to be more proactive. And besides that, overall, there are so many governmental benefits actually, and the hospitals like Robert Wood hospitals and all other hospitals in support of all those programs. But they are not finding a local people here. And in fact, we want to bring entire this, research related to chronic disease, and on top of that, all the preventive and all other methods to our community for the awareness of all of the people. So Param Care is basically, we have the outreach of all health-related issues, and we would like to make sure that we as a community utilize our stand here and let us get the benefit of better health and better education for all over the people in our New Jersey state.
My question to Mariam is, what will the program involve, Mariam?
So the program will involve a participant coming to the fitness center to have education lectures on the different topics that we discuss on exercise, diet, medication, cooking demonstration. They're also going to be giving the glucose monitors and will be taught how to use the glucose monitor so they can go home and continue to monitor their glucose. There are also going to be some follow-up sessions that we are going to be also reinforcing some of the education that we have done with them. Param Care has been very gracious in working with us to be able to identify, for example, yoga for the participants to do. We felt that we needed to do something that they could relate to, and yoga is definitely one of those things that they can exercise, and it's something that they can relate to.
My next question to you is, will the program be designed specifically for people from Southeast Asian community?
Yes, we have translated materials in Hindi and Gujarati. We're going to be using interpreters from Param Care to assist us with this. They're going to be registering people, and we are going to be also basing the food on the specific area.
And now, the most important question, I think this is, of course, Vipul Amin from Param Care with us. Why did you, think of partnering with Param Care? What was the reason behind it that you wanted to partner with Param Care?
I think that when you do community outreach and community health promotion, we need to look for those organizations within the community that the community trusts, that there's already a base there. It's hard and difficult for health institutions like a big hospital like Robert Wood to do this on a silo. We need to look for those organizations that are doing the groundwork, that are already planting the seed, and we can go and partner with them and bring their expertise and our expertise for the benefit of the community.
Folks, if you just joined us, you are listening to a special program on EBC Radio brought to you with the kind compliments of Robert Wood Johnson University Hospital. And, of course, joining me right now is Param Care Foundation's Mr. Vipul Amin is with us. And my next question to you is, Vipul ji, I know that you know the community so well, and tell us how this can benefit our community, this kind of initiative.
Kulraj, one of the issue that we are talking about is diabetes, and diabetes is very high in our Asian community, and I think if we don't care, because diabetes is the mother of all the disease probably, and if that's one disease, actually right now Robert Wood Johnson Hospital is bringing a lot of resource for us. And if we take care rightly, we do exercise and we manage our food, because our food has a lot of calorie, and it's very sensitive food part, and that's nutrition point of view. We need to get the right kind of balance. So on top of that, exercise is also equally important, and as we are all aware about our yoga techniques. So, what Robert Wood Johnson Hospital, Mariamji is trying to do, that bringing all those great research that they have already did with other community and got the good results. They want to do this exercise with us for almost, there are 6 sessions. There are spring session and there is a fall session, and every there will be 2 sessions in every session, and there will be 3 workshops. So they are not only going to just do the material outreaching, but it's also going to be demonstration and also going to be a lot of talks going. So those participants who are coming for all the sessions will get a lot of benefit. And on top of that, they are also providing the free meters and supply. So what else we need, because this is what the awareness they are going to bring us. And I feel we should utilize, and not only this diabetes program, but whenever there is a other community related events, for example, breast cancer awareness or prostate cancer awareness and all other chronic disease management, I think we must come out, and at least we should take part into all those good programs that coming up from organizations like Robert Wood Johnson Hospital, and we must take care of our good health actually.
That is so nicely said and so true that we got to take care of our health. And my last question to Mariam, and of course I want to let all our listeners know that Mariam is MA Director, Community Health Promotions, and at the Robert Wood Johnson University Hospital, and this is a very, very special initiative for our community, and we will give you more information how you can reach them. My last question to Mariam is, are there plans to build upon this program in the future?
Yes, of course. Diabetes is just the first disease that we're going to tackle, but as people were saying, we have done in the past breast cancer awareness. We want to make sure that South Asians have access to mammogram. We've been bringing them to the hospital to make sure that the women, prostate cancer has also been another big outreach effort that we have put in the hospital, and we want to make sure that the information gets to the community, and using the resources and the connections that Param Care has worked so hard to get, it will benefit the community at large.
And Mariam, if you would like to please give the information, if anybody wants to join the spring session, what they have to do and how to go about it.
So they need to call Neela at 732-404-0411, extension 5103, and register. There will be a session now in the spring and another session in the fall. During the summer, we will also be doing a prevention program for the sons and daughters of diabetics. It's a prevention, nutrition, and fitness program called Project Inspire, so our young people start living a healthy life.
Mariam, if you could just repeat that number once again, 732-404?
0411, extension 5103.
And anybody who's interested can call you at that number, 732-404-0411, extension 5103?
Yes.
And do they have to pay anything to get...
This is a free program.
Oh, this is a free program. That is so nice. I think people should...
It's a free program that is being funded by Johnson & Johnson.
Oh, thank you so much. I think people should avail this great opportunity and get in shape.
Thank you.
Mariam, I really want to thank you so much for coming on, taking time out and helping our community, guiding our community in the right direction. And people like you, they make the difference in the society. And thank you so much. You have been so kind. I want to just give an overview of your whole conversation. You have a minute. Go ahead, please.
Mariam?
Yes. Please go ahead. Yeah.
I just want to make sure that people know that we are here to serve the community. We have this special program for South Asians starting on April 17. Please call us if you're a diabetic and you need information and resources to take care of your diabetes. The phone number is 732-404-0411, extension 5103.
Do you also provide, if anybody needs any medication or any prescriptions?
We will be referring people to local physicians, your federally qualified health centers, if they don't have a doctor that they're seeing.
Mm-hmm. And of course, I also want to thank our special guest, from this special Param Care, Vipul Amin ji. बहुत धन्यवाद आपका. Thank you so much. And few words from you, sir.
Kulraji, this is what our event actually we should take interest into, and because the Robert Wood Johnson Hospital has so many other community to serve, but when they have selected South Asian community, so it is our responsibility how we can make this program more successful for our own benefit. And I wish that all of the listeners, of the EBC radio, I think let's take this opportunity and try to make this program as much successful for our community. Thank you, everyone.
I just want to say one thing before I close and let you guys go. I just want to say that this is a great proud moment for EBC Radio and our community that an establishment and a hospital like Robert Wood Johnson University Hospital has taken this initiative. And Mariam, thank you so much. Being the Director of Community and Health Promotion, this is something so valuable and such a great essence to our community. I think health is wealth. And I think we all need to get in shape. And I think with this program, we all will benefit. Thank you, both of you. Thank you, madam. Thank you, Vipulji. Have a wonderful evening and enjoy this cold, breezy weather.
Thank you for the opportunity.
Thank you so much.
Everyone.
Take care.